So hello guys, and welcome to the channel. If you're tuning into this channel, I'm sure you saw the title. You're trying to determine whether you would like to do concierge or not like to do concierge. So to do or not to do concierge medical care. So you probably fall into one of two categories if you're watching this video. Either you are a medical provider who's interested in concierge medicine, or may want to know more about it, or you are a consumer or patient who's interested in receiving concierge medical care and want to know more about it. So whatever the case may be, you reached the right place. Just stay tuned and let's get into it. But first, let me show you a little bit of how my day went working in concierge medicine. It is 5 a.m., 5:44 to be exact, and we are heading to Beverly Hills. Today is my first day working at a concierge medical clinic. So I'm going to just do a vlog to let you know what the difference is that I noticed working for concierge medicine versus like your traditional doctor's office. And I'll give you a little bit more in depth of what it is and all of those types of things. But I want to give a shout out to my hubby who is driving me. I know I am super spoiled. Super spoiled, but he needs to do some things over in LA too, so it just works out nicely. But anyway, yeah, welcome to the vlog, and let's see what it's gonna be like to work in concierge medicine. All right, so we're getting gas. So just wanted to talk to you more about concierge medicine. What it is, it's like concierge medicine is like an exclusive form of medical care where you have a physician available 24/7. You can have walk-in appointments, same-day appointments. It's just very exclusive. So the way it works is usually the members pay a fee. So like it may be a certain fee for the entire year, and then they can use the service as much as they want. So it's like a membership type of thing. And, you know, it just makes it a lot easier than having like to go to the emergency room or either go to a regular doctor's office. You're pretty much paying to have top tier service. So I'm excited. I've always worked in traditional medicine, or I worked in FQHC, so federally qualified healthcare. So what that means is like people can be billed or put on a sliding scale according to their income. Then the government helps to fund these health facilities. So I've worked on that end of things. I worked in traditional medicine where you just have your insurance cards, you know, like Blue Cross Blue Shield, United Healthcare, Aetna. You go to the doctor, you pay a copay, all those types of things. So I worked in that. And so now it's my first time working in concierge medicine where you have membership that they pay a fee and they come to get this top tier service. Now I have worked in plastic surgery, which will probably be the closest things to it, because of course plastic surgery is elective and it's going to usually be people who can afford to get plastic surgery, right? So I'm used to kind of catering to that population. I also worked in Buckhead. So anybody who knows anything about Atlanta and Buckhead knows what that population looks like. So yeah, I'm curious to compare this to it. Huh?
The bougie population?
The bougie population.
You are that population.
I was trying not to say it like that, but we all know what it is, right? So this is Beverly Hills, if that tells you anything. Yeah. So I don't have my light on anymore, so I'm going to go ahead and jump off and we will pick back up on this conversation. All right, guys, so I just finished my work day, 12 hours. So I am a little tired, but it was a really good day. It was really good. Everyone was super nice. I really enjoyed my day. So I will tell you guys a little bit more about it tomorrow after I get some rest. Okay, guys, so now that you watched a little bit of footage of how my day went, of course, I could not do a lot of recording because when it comes to anything medical care, or anything of those types of sorts, there is a HIPAA in place, which protects, of course, patients and their privacy. So I was only able to do just a little bit of recording just to kind of show you how my day went. me in the clinical setting and things like that. So I couldn't show anyone else. I didn't want to show what the place looked like or anything like that. But the main point of this video is to talk about what it is and pretty much some pros and cons of concierge medical care. So first and foremost, as a patient, some of the things that I noticed with concierge medicine was, one, the privacy that they were able to offer. So what I mean by that is when patients come into a standard doctor's office, usually there is a waiting area that everyone waits in, right? Well, with this particular company, the patients have a standard waiting area if they don't mind being seen and noticed by others and waiting with everyone else. Well, kinda. I'm going to come back to that. Or two, if they wanted to wait in a private area, they actually had a VIP waiting area where one person could wait alone and not be noticed and things like that. So when you're dealing with concierge medicine, it may be people of a certain status who don't want to be noticed by everyone else. So it's a great service. But I did say about waiting in the waiting room with everyone else. Another thing that I noticed is with the service, there really was no waiting time. So basically the customers or the patients have the ability to call ahead of time to see if they even need an appointment. So you have medical persons, a medical provider at your beck and call. So we had a triaging system where a patient could call in and you can immediately maybe not speak directly with the medical person, but you can kind of tell what's going on, and they would look at it, and then we will determine if we need to call you, if we need to text you or whatever. So the convenience was unreal. So if the patient was determined that, hey, we need to see you, you need to come in and be seen, then they can determine what time they want to come in. So we can look at the schedule to see when there was a free slot. That way, when they walked in, there was absolutely no waiting time. So I thought that was really good, because we do know in a lot of doctor's office, sometimes you have to sit down and wait. And sometimes that waiting time can be kind of long. So that was number two. Number three, I felt like it gave the customer or the patient a lot of control of their care. And what I mean by that is they could call in and say what's going on. They can determine, if I want to call, if I want to text, or if I want to walk in. Like, it just gives you more options and more control of your care. They also can determine what office they want it to go to. So there's multiple offices in this particular state. So they could determine which office was closer to them, and we all worked together, all had access to their charts, and all could provide great care. One of the offices actually offers a little more as far as testing abilities, like imaging and things like that. So for some diagnoses or some complaints, we would recommend them go to this particular office, because we would have more in order to gather information to determine what was going on with them. So that was number three, more control of care. Now, number four, this one really blew me away. Being someone who just typically worked in standard traditional medicine, hospital setting, doctor's office setting, home health setting, I never realized that this was available to some. So with this concierge service, if you want an in-home visit, you can actually request that a doctor comes to your home and sees you or your family member at their location. For me, at their home location, for me, that was like a big deal, especially with the elderly population that may find it difficult to leave home. To have that option for someone to come to you was like, wow, this is amazing. Now, it doesn't come without a price tag. So that is an additional cost if you want that. But this particular area is known to be an area where many people probably don't have any financial struggles. So it probably wouldn't be a big deal to them. And we actually had a couple of people that did request home visits yesterday. So I just thought that was pretty cool. Now, backing up, I don't think I talked much about what concierge medicine is. So what concierge medicine is, it is a member-only membership to a medical facility or a medical company that may have multiple facilities, because this particular company has multiple facilities in different states. But anyway, you become a member by paying like a yearly annual fee, and then you can utilize the services as much as you need, as much as you want. That fee is not particularly cheap. But in the big scheme of things, when you think about how many times you go to a doctor's visit or maybe pay a copay, and even with insurance, paying your portion, or if you have to go to out of network, like it really can be justified if a person can afford to do so. So that's what concierge medicine. You kind of really get like VIP treatment. You get a lot of assistance and care. So for example, like if you need to find a specialist, the service will do a lot of the legwork for you. So I mean, you're paying, but you're paying what you're getting for what you're paying is definitely well worth it, if I can put it that way. So that was number 4. You have more available to you. Not only can you get in-home visits, but you can actually get in-home tests. So if you want someone to come out and do blood work or do, lab tests or do different things, like you can actually pay a fee to have those things done. So lots more available to the patient. Number 5, 24/7 availability. So we do know most doctors' offices close at a certain time, maybe 5, maybe 8 to 5, 9 to 5, or, different hours. But with this particular service, and I don't know if it's for all concierge medical services, but they have 24/7 care. So there is a provider there 24/7. There is someone who can do lab work 24/7. So it reminds you of an emergency room, right? You can go to an emergency room at any time, but we do know that you're going to pay a hefty fee when you use the emergency room. You can have these same services available to you included in that annual fee that you're paying for this medical concierge service. So that was good, 24/7 availability. And then the last thing was you can have, and this can be in some standard medical facilities too, because I've worked in doctor's offices that did offer like x-ray, labs in-house, ultrasounds in-house, and things like that. But this particular company not only offered those things, but they offered things like CT scans. So we know that that's not usually found in a standard doctor's office. You usually have to go to an imaging center to have those done. Having CT scans and MRIs available to you, wow, 24/7, wow. Now, you still would have to, if you want to use your insurance to pay for them, you still sometimes have to get prior authorization. So I'm not saying that it can always happen at that minute. That would be like a miracle world. But chances are you'll get it done a lot sooner than you would sooner than you would in standard medicine. So that was a huge plus and eye-opening for me. So those are just 6 things from, I think, more of a patient or consumer standpoint. And now I'm going to move to some of the pros and cons from a provider standpoint. All right, so for starters, if you're anyone who works in a hospital setting or a doctor's office, one of the complaints that we often hear is a fast pace. Treating patients as just numbers, getting them in and out, the more the better. And for someone who is giving care, that doesn't necessarily feel good because for most of us that signed up to work in medical care, it's because we genuinely want to help people and we love helping people, right? But when you feel like you're just, people are in and out, you're not able to give the care that you want to give, sometimes that can be like, oh, it can weigh on you. So one of the benefits that I noticed with this concierge medical group is that you're able to see people at a slower pace. They're allotted more time, which in turn gives you the ability to offer great medical care. And so that's going to keep the providers and the medical personnel from getting burnt out. So that's number 1. It's not just about numbers, it's a better pace. And so I love that about concierge medicine. And I'm just giving this perspective from this one particular company. So I don't know, you may get in the comments and say, no, it's not always that way. Disclaimer, this is just from my experience with this particular company. All right, so in turn, you're going to have happier patients. Happier patients because if you're not having to wait, if you have control of your care, somewhat control of your care, your provider is spending time with you. People are super friendly, actually listening to what your complaints are and trying to fix them and get to the bottom of what's going on with you. You're going to be happier and more satisfied. So patient satisfaction, I feel like goes up with the concierge medicine. Then another thing, number 3, you're going to be able to give better care. And I kind of said that with number one. As the pace slows down, as you get more time with your patients, you're able to give great care. Number four, less burnout of providers, which I mentioned earlier. Provider burnout is a real thing when you're seeing patients quickly and just doing that for 12 hours straight. You can get burned out really quickly. So I noticed that the providers and the medical staff, the tech, and the radiologists and the radiologist tech, everyone was happy and in a good mood because no one was getting burnt out. We were seeing patients. Patients were happy. We were, making people feel better, and it was just a good atmosphere and environment. So definitely less burnout. And then the last thing I would say was the great follow-up. So we actually had time to follow up on patients that were seen previously. For example, if someone came in and they were having a respiratory problem or an issue, you gave them medication, and we had the ability to follow up with them. Not just, typically we would say, okay, follow up with me in a week. The patient has to make another appointment. The patient has to come back in. The patient has to wait again. No, we were able to take the time to call them to say, how are you doing? Kind of doing a telephone visit. How are you doing? Is your breathing better? What has improved? Has anything gotten worse? Just that follow up, I think, in care really keeps people from progressing and getting worse, because what if they don't make that follow-up appointment and they did not feel better? So in turn, I think that helps also to provide better care. This is just a couple of the things that I noticed working in concierge medicine. I actually get to go back this weekend and do more, so I'm sure I will find more things. As with anything, there's going to be some cons, I would say some of the cons would be like the cost. If someone couldn't afford to pay an annual fee or couldn't afford to have someone come to their house, those things could be a con. But for overall, I think it is an excellent service. It's excellent not only as a consumer or a patient, but as a provider of the service. And do I recommend concierge medicine? Absolutely. So thank you guys for tuning into my channel, and I would love to see you guys back. Don't forget to like, subscribe. I do random things sometimes, but things dealing with medicine. I am a medical provider, but I also love to vlog. I also love beauty products. So, I don't put myself in a box. So if you like random things, reviews, if you love beauty items, if you love to learn about healthcare, nursing, things of the sorts, then subscribe to this channel. And I'll see you guys again next time.